Hello, everyone, and thank you for joining us today for the Centers for Medicare and Medicaid Services Office of Minority Health, or CMS OMH's Coverage to Care Partner webinar. My name is Dante Webster, and I work with Ketchum, CMS OMH's communications contractor. Next slide, please. Before we get started, we just wanted to provide a few accessibility features for this webinar. First, closed captions are available. To access this feature, go to the menu at the bottom of the screen and click on Captions, which will display another menu where you can select Show Captions. Selecting Show Captions will allow closed captioning to appear at the bottom of the screen. We also have ASL interpreters joining us for today's webinar. To access ASL interpretation, go to the menu at the bottom of the screen and click on the interpretation icon. Under Watch, choose American Sign Language, and a video window of the interpreter that you've chosen will appear on your screen. Next slide, please. On this slide is the agenda for today's webinar. We will begin with an overview of OMH and the coverage to care, or as we call it, C2C initiatives. Next, we will discuss new and upcoming resources, including tailored materials and the launch of a new webpage. Following, we will provide insight into how to use the resources and how you can get involved in this initiative. Then we'll hear from one of the organizations that was able to collaborate with C2C for our inaugural Community Connections Tour, Latino Connection. We will conclude today's webinar with a Q&A session to answer any questions that you all may have. I'll now turn it over to Ashley Petticourt Austin from the CMS Office of Minority Health. Next slide, please.
Thank you, Dante, and hello, everyone. Thanks for joining us. So I'll begin with our CMS OMH overview. We can go ahead to the next slide. CMS is the largest provider of health insurance in the United States, responsible for ensuring that more than 160 million people, supported by all of the programs combined, are able to get the care and health coverage that they need and deserve. So our office, the CMS Office of Minority Health, is one of 8 minority health offices within the larger U.S. Department of Health and Human Services. Each office is aligned with their respective agency mission. So our office serves as the principal advisor to the entire Centers for Medicare and Medicaid Services on the needs of minority and underserved populations. So that includes people of racial and ethnic communities, people with limited English proficiency, lesbian, gay, bisexual, transgender, and queer persons, persons with disabilities, people who live in rural, tribal, geographically isolated areas or the territories, and people who are otherwise affected or by persistent poverty or inequity. We can go ahead to the next slide. So you'll see here our mission and vision. Our mission is to lead the advancement and integration of health equity in the development, evaluation, and implementation of CMS programs, policies, and partnerships. So our vision then is to see that all served by CMS achieve their highest level of health and well-being, and eventually to eliminate disparities in healthcare quality and access. We can go ahead to our next slide. So with all of that background from the larger CMS and the office itself, we have one of our key initiatives is coverage to care. So we always like to talk about the office to kind of frame where coverage to care is coming from. So previously mentioned, it's a health literacy initiative, and it focuses on increasing the consumer connection to care. And then in turn, part of that is having better health outcomes. And the C2C began with the idea that as people are enrolling in insurance, some of them for the first time or the first time in a long time, they need to know how to use it. And that doesn't come naturally. So health insurance can be confusing. And the idea is that we are here to provide resources and information that is for any type of health insurance, but in particular to make sure that Medicare, Marketplace, Medicaid is covered, as well as the populations that we just named that our office serves. Because a lot of times, those are the people who might have the hardest time navigating health insurance. So regardless of the consumer or the insurance type, anyone can use C2C. We want consumers to understand their health coverage and then actually use it to make that appointment with a provider who takes their coverage. And then that way they can get preventative services, primary care, and have a regular home to go to for their care. All of this with hoping that consumers will live a long and healthy life. We'll go ahead to the next slide. So coverage to care has a lot of resources that are available to assist partners and consumers along this journey. So they're all drafted and designed with feedback that we've received directly from partners, communities themselves, keeping all of that in mind. We want to ensure that the materials we create reflect the needs that people have, whether those are ongoing or urgent needs, So we have some regular opportunities to try and gather that information, and we're always happy to hear from you if you have feedback about what's working or what's not. Excuse me. So with that in mind, we have our signature material, the roadmap to better care. And that's the one that's pictured on the slide here. And it outlines 8 steps to connect to care and to lead to a healthier life. This was our original resource, the first one that Coverage to Care did, and it was updated last year. The first step in the roadmap is put your health first. So that's actually where we have an allowance to focus on prevention and doing things inside and outside of health insurance to stay healthy. Step 2 focuses on key terms with health coverage like copay, deductible. Step 3, listing the differences between primary care and an emergency department utilization. Newer to this version is where we also add in a little bit of explanation about urgent care. Step 4 then helps someone to find primary care provider who take their coverage. So thinking about how to find a primary care provider to begin with, and also to make sure that they take your coverage, make sure that your appointment would be covered. And then steps 5 and 6, we talk about preparing for an appointment. You make the appointment, you actually have to make that appointment and then prepare for it. So those are outlined as their individual steps because there are nuances to making sure that we're making the appointment with meeting all of our needs individually, and then preparing and thinking through any questions, medications, family history. And step 7, to take the time to ask if the provider is right for them. Were they comfortable? Were they respected? And that's something a lot of folks tend to skip over, as well as step 8, next steps after your appointment. We're doing a lot of work now to try and add in the care management pieces to this particular step and keeping the care ongoing throughout the year. So the roadmap is available in 9 languages. We also have a tribal version that we've worked with the Division of Tribal Affairs. And then there's a customizable version. All of these, of course, are on our website. So within the roadmap, there's a lot of cost-saving tips and an example insurance card that shows you, what the different labels are, and that is updated to match the recent legislation that came out. And then there's a sample EOB, explanation of benefits, that's also labeled with key points that somebody would want to understand, and a chart that shows you primary care versus emergency care side by side to help show the differences. All right, let's go ahead to our next slide. So that's a bit of an overview of what the general kind of signature roadmap would be. Some years back, we also created the roadmap to behavioral health. So this one was came up because we heard from a lot of folks that the roadmap is fine, but behavioral health is a little trickier and needs a little bit more nuance. So we actually work side by side with our colleagues in SAMHSA. SAMHSA is the Substance Abuse and Mental Health Services Administration. We're all part of HHS. So we worked with them together to create this piece specific to behavioral health care services. We do recommend that it's used alongside the roadmap to better care because we didn't want to have to repeat some of those main things and make the resource just way too long. So whereas the roadmap to better care, you'll find a definition for copay, deductible. In the roadmap to behavioral health, we allude to those definitions and where to find them, but we can focus on more specifics like what is behavioral health to start with, what are the different types of specific behavioral health providers, and to get into what is parity. So there's newer definitions in this resource, but you'll see it follows the same sort of cadence, the same type of 8 steps. So step 1, understanding your behavioral health. What is behavioral health? So we explain that there's the mental health as long as substance use disorder. And it encouraging people to consider it as part of whole health and just as important as physical health. So learning about health insurance. So this is where some of those key terms in the parity piece come in. Knowing where to go for help and treatment. So that's a big piece, is thinking through the differences. There's a lot of different types of behavioral health providers. So step 4 outlines lots of those different options for people and gives a little bit of a definition really to put with the different types. Then we talk through making an appointment, thinking through, where you're going to be most comfortable, making sure your coverage is accepted, being prepared for that appointment. So especially helpful for behavioral health. A lot of times you might want to write down some notes or a journal, or if there's things that you might want to share with your provider and you're afraid you might forget, it can be particularly important and useful to make notes ahead of time here. So thinking through that with a consumer. Step 7, talking about deciding if the behavioral health provider is right for you. That's again incredibly important for behavioral health because we want somebody to stay in care and stay connected and keep going back. And if they don't like the person, they feel like they weren't listened to, they're not going to go back, right? So we want to make sure that folks feel comfortable, and if they don't, we can work to find a new place. And then, of course, staying on the road to recovery, another really important one for behavioral health, being part of the care plan, understanding your part of the care plan and what you need to do, any follow-up appointments. So this particular roadmap for behavioral health outlines all of that information. And it's also available in translated languages. I believe this one's 8, actually. Let's go ahead to our next slide. So those are 2 of our big resources that we like to talk through a lot. Roadmap to Better Care is one that is kind of the go-to resource for a lot of our partners who do health literacy or do health outreach. And the Roadmap to Behavioral Health, we find it kind of comes in waves. During COVID, it was very needed. A lot of times after a disaster or something sad that happens in a community, we find another wave there. So it does kind of come and go a bit, but it's a good one to know that it's out there and to have that available. But then we also have some tailored prevention resources. These are really great, especially after someone's enrolled in health coverage or maybe re-up their plan from a new open enrollment or something. Hey, great, you got your coverage now. These are some free to you available services that you can get through that plan. So we have resources that highlight preventative services that are available to what we say is most consumers. So it's generally with Medicare and Medicaid, but certainly the healthcare.gov in particular, these are the covered preventative services. And then that extends to most general health plans. So these are great resources as a starting point. You can point to that $0 copay. Maybe if you know the person, you're able to kind of customize, hey, you mentioned something about your blood pressure. Maybe you could go and get a screening for that. We also have it specific to adults versus women versus men versus teens that kind of help add a little bit of customization and nuance to that conversation. And all of those are available in 8 languages. So each flyer kind of specifies preventive services for each of the groups. And then they also outline the vaccines that are available. So that one's a really great thing to have this time of year too, in case you want something on paper or something that you can email to somebody as a kind of physical reminder of go get your vaccines and look at these other things that maybe you can do while you're there. All right, so we'll go ahead then. Preventive coverage, by the way, this is another big one that a lot of our partners find useful. So just wanted to flag that for you as well. All right, let's go ahead to our next slide. All right, so I've already covered a few of the real key, most popular C2C materials. So I want to now highlight some of the new and more upcoming resources and some changes to our website. So let's go ahead to that. So as part of Coverage to Care in all our programs and initiatives at OMH, we are always looking for how we can improve and support the needs of our communities and our stakeholders, and anybody who's willing to give us feedback and input. So we are consistently and very conscientiously developing and adjusting our materials to fit that need. So it could be getting rid of outdated language or policies, or making something more up to date based on legislation or needs, but making sure that people can find the information they need for that longer, healthier life. So here's a few of those updates. To begin, on the screen, we have some resources that were recently refreshed, both in terms of newer language, but also the designs. So we talked through the roadmap to better care, the behavioral health, but you can see some of these are some of the translated ones as well. While the design may not seem as important as the content, we have gotten feedback from people about the clean, organized look, making sure that there's plenty of white space, using graphics to cue people in to help with some of the language pieces too, making sure things are plain language. And then of course the translations, as you'll see a couple translated pieces on the screen. So keeping that in mind, we used all of that to help feed into those updates. So on the left-hand side, if you're not able to visualize the screen here, we've included our recently updated 5 ways to make the most of your health coverage. So if you don't have time for the full roadmap, it is a long document. The 5 ways is kind of the short front back version of it. What are the things you need to focus on the most? And then roadmap to better care is in the middle. That is actually our tribal version. So you can see that there's a banner added to the top and the bottom, which is replicated on all of the healthcare.gov and Medicare resources and things that are co-branded under to give all of those kind of the same look and feel so that people know right away what they're looking for. And then on the right-hand side is actually the Ukrainian version of the roadmap to behavioral health. So as you can imagine, we had some requests for Ukrainian in the last years or so. So we've translated several of our resources to that as well. So at the end of the public health emergency, kind of the formal wrap up to COVID-19, we had also made some more updates. So we still have one COVID-19 resource out there. We had two originally during the PHE. So we still have one out there, and it was updated as well to make sure people had the latest on, staying updated on your vaccine and it's kind of some general information. So I previously mentioned how collaboration is very important. In the last few months, we've really been collaborating with the Department of Justice. So we hope to be able to announce in an upcoming webinar about a new resource that we are working on with them. We always have something going on in the background that we're working on. So we'll be excited to share more about that with you as well. So we try to be responsive to community needs, what's happening out there. So use this again as a shameless plug that if you have thoughts or feedback, feel free to send it to us. Some of the other ones we're working on right now, thinking through about prescription coverage and some other ways to make sure that we're staying connected and sharing our connected and chronic care management resources with folks as well. All right, so let's go ahead to the next slide. So as you can likely tell, Roadmap to Better Care is really kind of that key resource fundamental to our work. But not everybody learns from the paper document or email version or, that virtual, whatever format. So sometimes video is a little bit better. So we do also have a short animated video to outline the 8 steps that I had just mentioned. So we hope that this makes it a little bit more accessible to a wide range of audiences. So the video is actually linked on this slide so that we can be sure to share that link and everything with you today. All right, let's go ahead. I think we might need to go to the next slide. Sometimes videos play and sometimes they don't. I don't know that we wanted to risk that today or not. So we can go ahead. All right. So all of the resources we've mentioned are on our website. So first off, where do you find our page? Well, this is the kind of older one that may or may not look familiar. It's housed within the CMS.gov platform. So outside of Medicare, healthcare.gov, because it is meant, we intend to send things to our trusted community partners so that you can take the information and relay it to communities directly, to customize it, to personalize it to them, to their area, whatever the need is. So this is kind of the older look, but just wanted to make sure that you saw that so that could be refreshed. We tried to make things, kind of similar across the pages to replicate the graphics that you see in our newer resources, thinking through what would be a little bit easier for you to use. So we were able to kind of launch the new webpage. We've added on managing your chronic conditions. Actually, let's go ahead and advance one more slide so you can see what I'm talking about as I talk through it. There we are. Thank you. All right. So here's a zoomed in shot of the new webpage. So looking at people in different areas, kind of there's 3 different windows there, thinking through like there's people coming to this from different experiences and knowledge. So there's all the information is really the same. It's just a little bit better organized. So we have some new sections along the top, and I'll name those in a second. So we did this by reviewing some of the existing and expected resources and then cataloging them. So we have navigate your coverage, access care, get preventative care, manage your chronic condition, and then resources for partners and providers. So these new sections kind of help and basically streamline to help you find it and filter a little bit better. So the new page also has some keywords and some people first plain language to make sure that, if consumers end up here, it should be easy for them to use. But of course, we want it to be easy for our partners to use as well. We also revised how the languages appeared so that there's a drop down instead of listing all of them out. So it may be a little bit long. With the drop down, people are able to kind of get there a little quicker. On the Managing Your Chronic Condition webpage, so if you used the Connected Care, Chronic Care Management, that's where you'll find this. That also has a FAQ listed along the top, because sometimes people just have a lot of kind of general questions about CCM and how to access services, who it's for, that sort of thing. So we have some FAQs along the top. So if you're just looking for quick info, you'll be able to find that easily without having to scroll through a resource. And then finally, on the resources for partners and providers, we've combined our previous partner resources with our how to get involved page. So everything is all in one place. So if you're new to Coverage to Care, or you want to kind of refresh what you've been doing, this would be a good place to go. Along the top, we have information about how to become a partner, how to use materials, and then providing some resources that is available. And we'll talk a little bit more about that towards the end of the webinar. But we're excited to launch this new webpage. Hopefully it's easier for you to use. I'm happy to take any feedback, of course, and we hope it's accessible and useful for you. So at this point, we're actually, we can advance one more slide, and I'm going to turn it over to my colleague, Jessica Dawson, who is also in my office with the CMS Office of Minority Health, and she'll talk to us about some more of the resources.
Thank you, Ashley. Now I'll move into how to use these resources. Next slide, please. When using C2C resources, we recommend starting the conversation by helping consumers understand the materials and personalizing them. As outlined on the slide, when you start the conversation, you could use the Roadmap to Better Care as a tool to help your patients understand their new coverage and the importance of getting preventive services. Once you've started that conversation, give them the tools that they need to understand it. Show them where the explanation of benefits is and how to read it. Point out the cost savings tips that are outlined throughout the booklet. Show them the definitions for each of the healthcare costs, paying special attention to premiums, deductibles, copays, and cost sharing. There is so much information in the booklet that it may help to point out which resources are and which information is applicable to specific populations. Then you personalize it. You know your community the best, so consider what would be the most useful information to them. If diabetes rates are higher than average in your community, point them to the Managing Your Diabetes resource, or give them more information about preventive services available to them that will help them reduce their chances of being diagnosed with diabetes. You can even consider adding local resources and information so that they can access the information that they need. Next slide, please. To give you a better idea of the kinds of organizations and nonprofits that are using C2C resources, we've compiled a list on this slide. And as you can see, a wide variety of organizations are currently using our resources. Next slide, please. Before I close, I want to highlight how you can partner with C2C and share how organizations have partnered with us for our newest C2C initiative, the C2C Community Connections Tour. Next slide, please. Looks like I'm in the wrong place. Okay. So how can you get involved with C2C? We have a lot of information about this in our partner toolkit, which I mentioned was recently refreshed and updated with our new design and new information. In this toolkit, which is available in both English and Spanish, you can find a lot of information that we've already covered today. In the toolkit, which is available in both English and Spanish, more about the resources and how to access them, but we've also included information on planning a C2C event and a guide on drafting written content. It is a very high-level document that offers a wide range of audiences, different tools applicable to them for getting involved in their communities. Next slide, please. And again, just highlighting a different portion of the toolkit on this slide, we have a C2C community presentation, which walks through all 8 steps of the Roadmap to Better Care. With a set of prepared slides and a pre-written script, something you can use to inform your colleagues or use at a C2C event. And as I mentioned briefly, we have a section of the toolkit with sample text to use in a blog, newsletter, or social media posts and graphics. Next slide, please. And you can order these materials at no cost. We have most of the resources that we talked about today available at our warehouse, and you can visit our website, productordering.cms.hhs.gov, to place an order. C2C is always excited to hear from you, and we enjoy hearing about best practices, lessons learned, or feedback on any of the resources that you use for your communities. Next slide, please. So our newest C2C grassroots effort is the C2C Community Connections Tour. Throughout the spring and summer, we've been collaborating with local organizations and diverse communities across the country to help distribute C2C resources to C2C audiences during community events, and in turn, encourage consumers to learn more about their insurance and use the benefits. So far, we've distributed these resources at mobile clinics, food banks, health fairs, social events, and more. On this slide, we've included images from some of the tour stops where we've been able to share our resources. Throughout the C2C community tour, we were able to receive feedback that we can use to inform future collaborative efforts. We've learned that the majority of organizations agreed or strongly agreed that the C2C Community Connections tour materials were representative of people in their community, with the majority noting that our preventive service materials address the health concerns of their community members. We also learned that the majority agreed or strongly agreed that coverage to care resources addressed health barriers to health coverage access within their communities. In addition to feedback related to our CDC resources, we were able to learn more about how organizations felt about collaborating with CMS OMH. We learned that organizations found the collaborative opportunity useful as we've helped to provide information on their community needed and also helped to fill in information gaps. While they found the partnership useful, they also provided insight into how we can further tailor our tools to meet the needs of various communities. One of the best takeaways is that organizations would like us to continue to collaborate with them for future outreach. As the year progresses, we do look forward to continuing to work with the partners we've previously mentioned and working with additional partners in other locations. We could even be coming to a state near you. Next slide, please. In addition to visiting community organizations, we've also expanded our reach by traveling to minority-serving institutions, such as historically Black colleges and universities, as well as Hispanic-serving institutions, attending health-related school events where C2C resources are just as important. In April, we visited Howard University for its inaugural Wellness Day, where we were able to connect with students, faculty, sharing behavioral health, general health care, and Medicaid unwinding information. And recently we traveled to Morgan State University here in Baltimore to do the same thing. So it's really been a really good effort. Through this event, we've learned more about the specific health challenges and other health-related difficulties impacting students. By learning about these issues directly from students, we've approached our own resources with a different lens to examine how they can be adapted to help students learn more about the resources available to them in the health centers on their campuses or other facilities where they may go to receive their care. We hope to continue to collaborate with more minority-serving institutions to see how we can further tailor our materials to meet the unique needs of their diverse student bodies and help these institutions continue to bring awareness to the health services that they're able to provide for their students. Pictured on this slide is one of the two resources that we've tailored for college students. This one is the Put Your Health First College Students. Listed on this resource are screenings that are available to college students at most health centers and for no cost under most health coverage. This includes mental health screenings, alcohol and drug screenings, well woman visits, and more. In addition to these screenings, this resource also provides available vaccines and tips that students can use in the event that they are charged for services. I will now turn it back over to Dante Webster.
Thank you, Jessica. So as we hope this presentation has shown, as we hope this presentation has shown, it is an honor to collaborate with organizations, and we greatly appreciate the feedback that we receive. George Fernandez and Sean McCormick for Latino Connection, one of the organizations with whom we collaborated for the C2C Community Connections Tour, will now join us to discuss their organization's experience with and the feedback that they received with C2C and the feedback that they received in their community. Next slide, please.
Thank you so much, Dante. It's a pleasure to be here and join all of you today. My name is George Fernandez. I'm the founder and CEO of Latino Connection. Latino Connection is a social determinants of health marketing and communications outreach agency. And we partner with community, business, healthcare, education, and government entities. And we help them understand strategies and identify solutions to reaching hard to reach communities, predominantly Latino and African American. Joining me today is Dr. Sean McCormick. our Senior Project Manager for Public Health. Sean, I'll turn it over to you.
Thank you, George. Good afternoon, everyone. Yeah, my name is Sean McCormick. I use the he, him pronouns, and I'm a Senior Project Manager with Latino Connection. And myself, along with Jean Kubalet and 10 or 20 different community health engagement specialists, community health workers, and brand ambassadors help us to push out these coverage to care materials at a few of our events. So we've got a few slides to share about how we did that. Next slide, please. And so, as George mentioned, Latino Connection serves communities of color, under-resourced areas and populations. And so the coverage to care focus on primary care and preventive services was a really great fit for us. Next slide. So it was really good timing. We were connected with Ketchum and CMS and the coverage to care folks just a few weeks before what is our largest event, our annual Latino Health Summit. There's a few pictures there. It's a 3-day event that is a combination of professional development and community health education. And so we were able to table with the coverage to care materials at our community focused event, which brought in hundreds of people from the local area and around Reading, Pennsylvania. If you're not familiar with Reading, Pennsylvania, it's a growing city that has now it's a majority of the population is Spanish speaking. So it was a really good opportunity for us to get the C2C materials in front of a growing and diverse population. Next slide. Yeah, so I just gave an overview of the event. We had, I don't know, probably 50 different vendors or tables, and we were able to put the coverage to care table right up front. So as folks walked into the conference space, there was registration, and then we were the first table that they came across. And so part of how we operated the event was and encouraged people to stop by the different demonstrations and exhibits, as well as the tables, was to connect table and demonstration visits to a sticker. You got a sticker when you visited a table, and then if you filled up your card with stickers, you were entered into a raffle for all sorts of healthy prizes like air fryers and vegetable steamers, yoga mats, things like that. So we were right up front with the coverage to care materials at the summit. Next slide, please. Yeah, so we had at least 500 people. That's probably an underestimate. You can see a few pictures there of some of the individuals meeting and greeting, doing some networking, one of the speakers in the middle there, and then there was a Zumba class on the right there. Next slide, please. And so here's a picture of George, who was just speaking. George, thank you. He got his hands dirty the day of and was helping to promote the coverage to care materials. So yeah, there's a couple of our staff there. We had folks that can speak Spanish and English. And so we were able to communicate the offerings and the purpose of the C2C initiative. Next slide. Yeah, it was nice. We had, you can go to the next slide too. You know, whether it was individuals who would come up and then we would grab the piece of information that was most relevant probably to that individual, or if there was a whole family that would walk up, we would have a few of the materials all ready to go in sort of a little packet ready to hand over. And it was nice. People, I don't think, were aware of all the different screenings and vaccinations and the well visits and all the good things that are part of primary care and preventive care. The content and the messages were definitely needed, and people had at first maybe they'd look a little bit confused, but then after the 30-second or 2-minute interaction, they had a little bit of a smile on their face. It was overall really positive. Next slide, please. There's a picture of me giving someone a sticker for stopping by the booth and having a chat about C2C. Next slide. So yeah, part of our work involves, for pretty much all of our initiatives, is press and media coverage. As we do all sorts of community engagement and public health education. We also have a great communications and marketing team. So we had professional photographers and videographers and a social media team ready to go to capture the work and to share our efforts through social media reels and stories, and as well as through local and regional TV news and regional press. Next slide. So in addition to the Latino Health Summit, we also distributed coverage to care materials and engaged community members during our mobile events. And so, again, it was a natural fit with this aspect of our work. You can see there's a picture of one of our mobile health units called CATE, Community Accessible Testing and Education. CATE emerged when COVID-19 became an issue where testing and vaccinations were badly needed across Pennsylvania. And so we partnered with the Pennsylvania Department of Health to hold hundreds of vaccination testing and education events, and to have one-on-one conversations, face-to-face conversations, to answer questions about COVID-19, testing, vaccinations. And as Kate has rolled along, we have expanded the services to include things like blood pressure, height and weight, glucose screenings, flu vaccinations, as well as other health education, such as like diabetes prevention and self-management, tobacco cessation, any sort of clinical community clinical connections type work, closing the gaps between communities and clinical services. So it was a natural fit to talk about primary care and coverage to care. Next slide, please. And so there's a picture of a couple of the larger CATE units. Next slide. And there's just one more picture of some of our mobile events. And we have music going. As you can see, there's some bubbles at that one event, and just create a really engaging, high energy experience where people can get together and lean into managing their healthcare and their health. Next slide, please. So in this partnership, in addition to the Latino Health Summit, we had 2 mobile events, community-based events, where we promoted the coverage to care offerings, both in April 2023. Alder Health Services in Harrisburg is a primary care site that mostly serves LGBTQIA individuals, and provides HIV and AIDS related care, but also primary care services. So that was a great fit to promote C2C. And then we've got a wonderful relationship with a church in York, Pennsylvania called the House of Reconciliation. And our staff and the team at House of Reconciliation work together to reach people with the C2C materials at that event as well. So again, natural fits for this type of partnership. Next slide, please. Few takeaways: the messages and the flyers were well received. People definitely appreciated some insights about all of the different offerings within primary care, some tips on what to do next, how to make appointments. We sprinkled in a little bit of building people's self-efficacy or confidence in asking their primary care provider about these services. Not being afraid to ask for how they can access these sorts of screenings and vaccinations and whatnot. As I said, the coverage to care materials and content really meshed well with our events. Just a couple areas of improvement. I know the roadmaps are great. I think one thing that was lacking from our booths, and it was mostly just that we didn't have a whole lot of time to plan it all out, but we had these great events coming up, and that this is such a perfect fit. We want to just get these materials out and have staff train. I guess I could have mentioned this too. We had a number of our staff trained, on what C2C is, so they felt really comfortable in engaging community members with this content. Right? If the folks doing the outreach don't understand the content and the purpose of the materials, then it's hard to communicate with confidence and genuine and authentic trust and interest in that this is a valuable resource. So our staff were trained thanks to CMS and Ketchum for training our folks. I think I saw actually in some of the slides in the community tour that they had the tall banners with the roadmap on there. That would have been something that was great for us. But again, our staff were well trained and knew how to lay it out nice and clear. This is what you need to do next. If you don't have a primary care provider, here's how you find one. And then you can take these flyers into the appointment with you and ask, hey, what makes sense for me, doctor? And then, yeah, everything was great. The materials are clear and very helpful. Again, would have been nice potentially to have some more large format materials like stand-up banners, a tablecloth, a tent, maybe T-shirts. We had our own T-shirts on. So anything to make the C2C brand more visible. But of course, those things come with a cost, and then you have to sort of draw the line somewhere. But so really, it went great, and our staff enjoyed the work and felt like it was like I said, a natural fit for what we were already doing for the community. Next slide. I think that's it. Yep, feel free to take any questions if you have any, and we're always open to talking about future partnerships or brainstorming new ideas for C2C outreach. Thank you very much.
You can go to the next slide. Thank you, Sean. Thank you, Sean and George, for that presentation and giving us an overview of the partnership. And with that, we now have time for questions. So the Q&A function is available. So we ask that you submit any questions that you may have, and we will answer as many questions as time permits. These questions could be about the resources that you saw today, or also questions related to the collaboration opportunity with Latino Connection. So we do have a few that we already have here. So I'll just get started with reading some of those. And again, please submit any questions that you may have. So just to get us started, per types of modalities for the roadmap to better care, has CHW/community health offices been trained to disseminate these resources, e.g. by call or in-person appointment to their communities?
Hey, Dante, it's Ashley. I'll take that question. So sometimes, so the Navigator program that is run through our healthcare.gov team does actually include some training on health literacy and uses coverage to care as the example there. So there is some formal training out there for navigators and assisters. Otherwise, we tend to use this type of webinar, and sometimes we go into more depth about like the roadmap itself and a little more detail about how to use it, how to talk about it, and use those as kind of train the trainer type activities. So we do have some resources on our website to help with that. So it's not a formal training, but we have some past webinars that might be of use. There's a partner toolkit that talks about which resources to start with, how you could talk about it, how to customize what you're doing. And then, of course, if you have any further questions, we're always happy to connect as well. But we tend to use this type of webinar and sometimes those other written materials as well.
Actually, I think you dropped a little bit there at the end of the response.
I'm sorry, you said I dropped a little bit here. I seem to be having issues today. So there's a little bit of stuff and informal training, if you will, on our website. So past webinars, partner toolkit, and a PowerPoint presentation that's actually written for anybody to just pick it up and use it. It's got the script and slides and everything ready to go. So that one in particular can be a lot of use if you want to do your own train the trainer.
Okay, Thank you for that initial response there, Ashley. And then the next question that we have, will C2C have any information for individuals related to surprise billing?
I'll take that one too. So for surprise billing, and in general for the No Surprises Act, that one actually timed pretty well with when we were updating our roadmap to better care last year. So there were some pieces of it. One example is the sample insurance cards. So under that law, there were certain pieces that needed to be added to insurance cards that sometimes were there and sometimes weren't. So we made sure that our sample insurance card reflects all of those updates that came out of that. And then we've also, so we aren't planning something separate from that. There's a couple other very small pieces that changed in the roadmap to better care from the No Surprises Act, but outside of that, we actually have just worked behind the scenes with our healthcare.gov team to help review their materials and all the pieces that they're putting out. So not separate from what they're doing, but we have interacted with them, and we know that they've had a lot of work going into that.
All right. Thank you, Ashley, for that response as well. And then the next question that we have, after these materials were created and the information sessions done, have you seen a correlated and measurable change in services used?
So I'll start with that as kind of like the big picture answer, but Sean, if you had anything you wanted to add just like from, you know, like the immediate effect or anything, please feel free. So we do some studying in the back, like a more formal survey of organizations and users to see what's working, what they like, what's not working. In general, there is a positive correlation and there is an improvement. It's hard to depict if that is coverage to care or if that is something else somebody's doing or if it's all of those things combined. It's probably all those things combined and something we don't even know in general. But we do try and look and see if that's working and try and use that, you know, real research backing to figure out what we need to do and adjust. So we do look into that. There's a little bit out there that's very dated at this point, but we hope to be able to publish more on that in the coming years. We're kind of, we take a long time with it because we want to make sure that it's thorough and that we're really thinking through everything we can. So when we're able to put out that kind of research on our own program, on our own program, we will. But in general, we are seeing positive correlation, but it's still fresh data. If anybody wanted to add to that though, from any of the other speakers, please feel free to.
Just standing by here, please submit any additional questions that you may have. Again, we'll take as many as time allows. So if you have any additional questions, either on the presentation resources that you've seen today or the collaboration with Latino Connection, again, please share your questions and we will ask them.
Dante, I saw the note about one of the links wasn't working, so I'm going to see if I can can I chat everybody? I can't. So I'm going to put this to Dante, if you maybe could send this out to folks in the chat. The slides, transcript, and recording from today's webinar and past webinars can be found on our website. So I had mentioned that we have some past ones up there that might be useful trainings. So today's will be added to that list, and the link that should be coming around soon. There was one that was sent to answer somebody's question that didn't seem to work. So a new one coming around soon, but there will be recording and everything posted online once we get the transcript and everything together.
Yep, I have that link and I will send it out shortly, and then momentarily actually.
Thank you. I'm scrolling through the chat. I'm not seeing anything else coming through, but if any other questions come up, please always feel free to reach out to us. If we could advance one more slide, it's got our contact information there, which is coverage2care@cms.hhs.gov. You can send us an email there anytime. I check it myself. Probably the easiest email to give out to you. So coverage2care@cms.hhs.gov. If you have any questions about today or C2C or how you could do more, please feel free to reach out. We'd love to hear from you. I think that's all I see in the Q&A, Dante, unless I missed something.
I believe that was everything that we had for today. Yes, that was all the questions.
Okay, well, we'll go ahead and wrap up. Everybody can get to their 1 o'clock meetings or 10 o'clock, whatever time it is where you are. Thank you.
Thank you.